Good morning, everyone. Good afternoon and good evening to everyone joining us from all over the world. My name is Adebiyi Adeshino. I am PAI's Director of Health Financing and Health System Strengthening, and I will be your lead facilitator for this investment case workshop. It's a pleasure to welcome you all to this capacity building event. It is tailored to be able to provide you an overall view of the GFF investment case and the process that it entails. Our hope is that at the end of this workshop, you will have not only a better understanding of, but appreciate also what all our colleagues and partners from different countries are experiencing within their roles as the CSO, WILO, or global goods partner within the GFF process. As I mentioned when this call first started, please introduce yourself using the chat box. Please add your name, the organization that you're representing, and the country from which you are working. That way we'll have a better better understanding of all of the people who are attending this session. It's truly a pleasure to have people from all over the place, from as far west as Burkina Faso and as far east of Africa as Madagascar. So without much ado, I'm going to start the presentation. I will share my screen so you can follow along. Or I will say for those who are French speaking, our colleague Vincent Villeneuve is on the French channel. If you select the interpretation and go to French, you'll be able to hear him translating this workshop in French. So please be sure to use that function if you prefer to listen to this presentation in French. If there are any additional questions or anything, please use the chat box. Our colleagues, Tess and Eric, will be providing support to you and funneling those questions and or comments to us. Please let me know. Please feel free to raise an hand or interject if there's any piece of this that is that you need clarification. I will be pausing at different points of the presentation to address any burning questions or comments. Otherwise, we will have a fairly lengthy discussion section at the end of the, once we've concluded the description of the investment case. So there will be a chance for very vibrant, rich conversation and discussion amongst ourselves and to ask key questions too. So without much ado, I'm going to share my screen, and you'll be able to see the presentation. All right, so today we'll be talking about how the investment case is developed in the GFF process. As we've already shared with you all in the agenda, I'm just going to go through that really quickly. We've already done the welcome and introductions. We're going to now jump into the background on the Global Financing Facility, what you know as the GFF, and then go into more detail about the investment case, providing the description and the different stages of the investment case. And then we'll have a hopefully very interactive question and answer session, and a little bit of a small group discussion, so that we get the true meat of this process, which is experience sharing, because everybody comes to this process through different perspectives and different contexts, and their countries' experience with the GFF and their respective governments brings a breadth and depth of experience that is rich in its ability to help us understand the full scope of how CSOs can engage the GFF. And once we've done that, we can provide a little bit of a report back if there's time, and discuss a little bit more about the key issues that are engaged in the small group discussion. After that, we will give a brief overview of the training session and of the next training sessions, and discuss potential support for you all. Hope this gives a good perspective on our discussion today. Again, I will be pausing along the way to allow for burning questions and or comments. So without much ado, I'm going to start with a little bit of background on the GFF. Some of you probably know this already, but for those who are just new to the process, it's good to get a little bit of understanding on the foundation of the GFF and the process. So the GFF was established by the World Bank, United Nations, with support from donor countries, the US government, some Scandinavian partners, the UK Development Agency, and foundations, including the Bill and Melinda Gates Foundation, Hewlett Foundation, and a few other key partners from around the world. The primary aim of the GFF is to provide funding for sexual, reproductive, maternal, neonatal, child, and adolescent health, plus nutrition initiatives. I know that's a mouthful. We call it SRHMNCAH+N, but that's generally the acronym that's used. And it provides this support to 36 countries in two key ways. The first is it provides technical assistance to develop the health policy and financing strategies from which the country can then move forward in terms of implementing these initiatives. And the second part of it, in addition to that technical assistance and guidance and support, it also provides direct grant funding for the poorest countries who are IDA members, essentially. And this funding is provided at a specific ratio of grant to loan. And what that means is that a portion of that grant, a portion of the funding that comes from the GFF, part of it is grant, part of it is a loan, a low interest loan. And the way that generally works, at a ratio, and that ratio, and I'll explain it as best as I can here, that ratio comes at 1:3 or 1:4. What does that mean? It means that for every, let's say you get, your country gets $1 million, right? And so if your loan is $1 million and you have a 1:3 grant to loan ratio, that means that $250,000 of that 1 million is going to be a grant. The remaining 750,000 is going to be a loan. So that's 1:3. That's the ratio. If you put 250 next to 750, that's 1:3. So that's the meaning of that. For a 1:4 ratio, it means that if you get a loan for $1 million, for every $1 million that you get, 200,000 of that is going to be a grant, while 800,000 is going to be a loan. So that's the 1:4. If you put 200 next to 800, that's 1:4 grant to loan ratio. So that's just to explain the process. The next piece of the support that that the GFF provides to the government is in an agreement of co-financing strategy from the government side, using domestic government resources to both ensure that it improves efficiency and impact, because the GFF process is a partnership between the GFF and the country government. So both need to provide funding, adequate funding, to be able to meet this needs, to show the goal of ensuring long-term and sustainability of this initiative. And a key part of this is that there's strong coordination with the health sector. So ensuring that it's not a parallel standalone initiative. So it's not that it's just funding maternal and neonatal
SRHMNCAH initiatives alone and focusing only on those, it ensures that that initiative is in line with the entire government health sector plan, so that there's no separate or inefficient way of having a different goal. It is all included within the government strategy, and more importantly, it's included within the primary healthcare delivery system, so that there isn't any deviation with what is overall the government's health sector initiative. So with that said, I want to go into a little bit of detail about the investment case and its process. The investment case is essentially a plan, a way forward. You don't know where you're going unless you have a plan or a map for how you're going to get there. And that's what the investment case provides. The investment case is a key step for receiving GFF funding. Basically, it shows both the government and the GFF that there is a clear set of objectives and a clear set of activities that will be implemented to achieve those objectives. And it provides pretty good detail on what that process will look like in order to provide guidance as to how you will meet your SRHMNCAH plus nutrition objectives. So how do you go about securing or developing that investment case? The investment case, excuse me, addresses 4 essential questions. That is the what, which is, as I mentioned before, the objectives that you will focus on, and which interventions are most likely to achieve those results. So, for example, if one of your key objectives is reducing maternal mortality, then the interventions in this example of context would be implementing family planning services, providing, expanding access to antenatal care, and expanding access to assisted delivery services. So that's an example of addressing the objectives as well as the interventions. The other essential question that the investment case is how will those interventions be delivered? So using the example where maternal mortality is our objective, the how is essentially increasing the number and training of healthcare workers on family planning, antenatal care, and assisted delivery. The third essential question is who will deliver those, who will receive those services? And in this case, we're focused on women of reproductive age, who are the primary focus for addressing maternal mortality and morbidity. And it specifies where the service recipients, those who are receiving the services, where they live, and how the services will be delivered to them where they live, will make it easier for them to access it. So, for example, if you're trying to reduce maternal mortality, you need to focus on those areas where maternal mortality is the highest, where you are most likely to have the impact and desired impact in lowering maternal mortality. So you might have a focus on rural or peri-urban areas that have lowest access to family planning or lowest access to ANC and assisted delivery. So in that way, you are able to identify the areas of high need. So in addition to addressing these 4 essential questions, the investment case also provides a cost of implementation. In other words, it tells you how much would it cost to implement these interventions. How much would it cost to get to that process, to get to that to achieve those objectives for SRHMNCAH. And in addition to that cost, it also provides you with a resource map of where all the resources are coming in to be able to support that objective. So it create a clear resource, what they call a resource map of incoming resources, as well as how they'll be tied to your investment case in terms of its implementation. Lastly, the investment case must include monitoring and evaluation, because how else will you be able to assess how you're moving along in your implementation at your desired pace, at your desired outcomes, to get to your desired outcomes, how you are ensuring that the process is being moved along. And it also assesses the outcomes at the end of the day to be sure that did you actually achieve the objectives that you set out to achieve. So these are the key elements of the investment case here. In terms of the different stages, the investment case is the initial process before full implementation of your SRHMNCAH+N initiatives. And that initial stage, that investment case process, is broken down into 7 specific areas. And I'll go into more detail about it, but just to give you an overall view of this, those 7 areas include having an outline and approach, conducting a situational analysis, reviewing your bottlenecks and potential risks, generating your costs, assessing your cost effectiveness, and looking at your resource map, how you prioritize your return on investment, and your monitoring and evaluation plan, and lastly, that financing agreement between the governments, whether it's your national governments or your subnational governments, with the GFF, in order to provide the financing for implementation. And then you start the implementation process. So we're going to go into detail about these different stages, and we will discuss what the key activities for each stage entails, what the expected outcomes from those key activities are, who the primary players in each of those stages are, and how CSOs can engage with them, the kind of questions that you can ask, the kind of interaction and engagement that you would like to see in order to meet your mission to ensuring both accountability and advocacy, increased advocacy for expanding access to SRHMNCAH. I want to pause a little bit here to see if there are any questions. I want to be sure that we have an opportunity to address any burning questions. Otherwise, if there are none, we can always move forward. Our goal here is to ensure that we have a very rich discussion at the end of the description, but we want to be sure that if there's any sort of key questions happening along the way, we can address those questions. I don't see any questions in the chat box, and I don't see any hands currently raised.
Hello.
So, yes. Can you?
Sorry. Exactly. Sorry about that. I joined you a little bit late. I'm in the provinces. I was struggling with my internet. This is the executive director from Health Alert, Sierra Leone.
Pleasure. Thank you.
Yes, thank you. So I just one quick one on the aspect of the M&E. You've seen the monitoring evaluation component of the investment case. Now, does that, do you mean that should be included in the investment case developed by the government, or it is our own M&E, which as civil society we do, which is which actually? Is it on our part or on the part of the government?
That's on the part of the government.
Developing the M&E component.
Yes, thank you for that important question. That is on the part of the government. That is it's part of the investment case. So it's part of the government, part of the not just the government, but part of the stakeholders in developing the M&E. It's a full M&E related to the investment case.
Right. Okay. Exactly. Yeah. Even though most times in our situation, it's the government actually does the monitoring, evaluation, but where does the civil society comes in that M&A?
We will discuss that as we go along, because we're not into the detail yet.
All right. Okay. Thank you. Sorry. Okay. Let's move on.
Thank you. I don't see any other additional hands, so we can jump into the question now, into the descriptions of each of those stages now. So the first part is determining the investment case approach. This is basically as they say, the bare bone structure, developing the skeleton, the scaffolding around what the investment case will look like as you move forward. And this essentially entails, reviewing what existing strategies, that is existing SRHMNCAH plus nutrition strategies there are in your country or subnational context. So that you are not starting, nobody starts from zero. You always have something in place in order to start from there. So you know where your starting point is. The other piece of that, once you know the existing strategies, you will start drafting an approach and a work plan to identify those key intermediate outputs and how they all interact with different pieces of what's going to involve in the investment case itself, not the actual SRHMNCAH initiative, but what will you put into it? What will the investment case involve? Who will be involved in it? And provide an extensive stakeholder analysis, that is all the key partners that are involved in ensuring that the investment case comes together representing the full scope of those who it's going to have the impact on. And there's an agreement on how you have a country platform, essentially the country engagement mechanism for with the GFF, who's going to be in it, how it's going to interact with the different stakeholders, how it's going to bring the voices of all the stakeholders together to ensure that it's that the investment case itself is fully representative of the government as well as the people it's most likely to impact. And so with these key activities, you can expect to see an investment case roadmap that includes timelines and different milestones as you go along, tells you what's happening through the different stages over the timeline of the implementation process, and it tells you, like, when are you going to put all the pieces of the investment case together, who's going to be responsible, who's going to review, and so on and so forth, things like those key pieces. And it'll also include your stakeholder engagement, which is a really important piece because it tells you who are all the different key players and decision makers who will be involved in the development of the investment case and in shepherding it forward through its implementation. And so the key actors in this process and the forums in which you can engage those key actors include the Ministry of Health, obviously, because they are generally the lead agency in this. It will also include those key program directors within the Ministry of Health, those who are in charge of sexual, reproductive, maternal, neonatal, child, adolescent health and nutrition. It will involve the policy director within it and possibly the research directors within the Ministry of Health. It will also obviously involve the GFF country coordinator, because that is the key point for the GFF in terms of engagement with the country. And it will also include all those other non-governmental service providers, those who provide SRHMNCAH plus nutrition services, because it's not just the government that's entailed. So these are all the key major actors that will be needed. And in addition to that, obviously there will be a need for civil society partners in the process. And so the ways you can engage these key actors include either your National Technical Working Group Committee, having where they'll have public consultation days or events We'll have public commentary events. So within those different forums and those different engagement points, you can reach out to these different actors to be able to get their attention on how they're moving the investment case forward. Some of the possible advocacy and/or accountability questions that you can put forward to them include, identifying who are all the key stakeholders. Is the stakeholder platform representative of all the people that need to be there? I know some of the partners in their responses to the pre-workshop questions that we share with us, them, told us in their responses that some of the challenges they faced in the process was that CSOs were not engaged in investment case in the first round of their country's investment case, and in addition, there were no key partners working on, say, demand generation and all these other pieces of what SRHMNCAH includes. So their feedback helped us understand, this question, put together this question, identifying who the key stakeholders are. So that's a key question of this stage of the developing the investment case approach. The second part, once you've developed your approach or built the framework, the skeletal framework for your investment case, is going to be conducting a situational analysis. And what does this involve? Situational analysis includes collecting and analyzing both existing and new data, understanding all the information around the causes and the underlying factors that influence or affect SRHMNCAH+N. Things like maternal and infant mortality, morbidity, looking at adolescent health and all the other factors that affect adolescent health and well-being. And it looks at multidimensional key factors like equity, efficiency in ensuring how efficient are those interventions that meet the need, that are supposed to meet the needs for SRHMNCAH+N initiatives. And looks at all multi-sectoral determinants, multi-sectoral being beyond just health, looking at things like education, looking at things like rights, looking at things like rights and access, and looking at things like nutrition, agriculture, and things like that. So looking beyond just the health sector factors that affect maternal, infant, and adolescent health. And then within this situational analysis, once you've identified those factors, be able to prioritize the results, that is, determine which aspect of the SRHMNCAH continuum to prioritize, which area are you going to focus on in terms of developing your implementation plan. And then lastly, but not least, obviously, is the defining your targets. That's saying, understanding where the country expects to be by the end of the implementation of the investment case plan. So say most of these targets are within a 3 to 5 year limit. Some are from the feedback that we receive from partners, get extensions over time to be able to fully implement their program. And just to provide a little bit of context to that, that's often the case because of the impact of the COVID pandemic that affected ministries of health in their ability to prioritize interventions. So in some cases they had to extend their investment case implementation beyond the the regular 3 to 5 year timeline. So these are the key these are the key pieces that activities that need to go into the situational analysis. And the outputs that you can expect, obviously, are going to be the work plan itself and an agreement on the results areas, whether you're going to align with the SDGs, so 2030 objectives and targets, or you're going to focus exclusively on the investment case 5-year milestone. Again, the key actors, players in this process will always be there'll be a lead. At this point, there will be a lead government or non-governmental technical coordinator, somebody who's bringing together all the key stakeholders and collating decisions that are being made and outlining how those decisions are going to be implemented. Generally, this person can be part of the government or not, but it works on the technical working group with all the key stakeholders. The other stakeholders will be the Ministry of Health, obviously, and their directors or their representatives of the Ministry of Health and their directors. The GFF country coordinator, your NGO, non-governmental service delivery implementers. You'll be able to engage with them in the different forums that include the technical working group or committee meetings. You'll be able to work with them as they provide the sharing the outputs of this situation analysis, the results of the situation analysis for public commentary or public consultation. Some of the questions that you can ask, to be able to fulfill your roles as CSOs for this stage is, does the situation analysis provide a comprehensive assessment of the health status of women, adolescents, and children? Does it understand the full scope of what affects their health, the morbidity and mortality for these three important demographics? And as I mentioned earlier, is it taking full on the scope of the multi-sectoral factors that include education, that include nutrition, agriculture, that includes rights and access. So these are some of the questions that need to be identified. And another key question is, does it identify gaps in access by income? Those are key pieces these are key areas in which generally access can be assessed. So looking at things like, are people with lower income less likely to access services, which is generally often the case? Are people in urban areas more likely to access than the people in rural areas or hard to reach areas, which generally is the case? Are youth less likely to access services because they are youth? So those are some of the key questions that you can put forward in order to better address and understand where those key gaps are in the situation analysis. Moving along to the third stage of the investment case is looking at the bottleneck and potential resources that and risks that go into this. So you're identifying key bottlenecks and looking at those areas that are choking access, choking efficiency of delivering those interventions that address the lives and well-being of women, children, and adolescents. So that's generally what bottleneck is, looking at those points where a lot of effort is being put into meeting the needs of women, children, and adolescents, but you're not getting the expected outcomes of improving their lives. So you need to look at what might be stymieing or holding the full impact of the interventions. And then looking at those high impact interventions, those interventions that have the greatest impact in terms of rolling out those interventions. So looking at which intervention is best likely to increase immunization, which intervention is best likely to increase access to family planning services or to antenatal care or to assisted delivery. So, to use the example of family planning, which high impact interventions can be the difference between ensuring that there is greater access to family planning or contraceptives, ensuring that there's demand creation to create better awareness rather than just training healthcare workers. Another key area is looking at immunization. If your goal is to look as to increase immunization, one high impact intervention has been identified is beyond just expecting people to come into clinics, is to have mobile clinics that go from different areas to around the different areas to be able to provide immunization. A key high impact intervention and very effective intervention is where they combine both immunization and family planning access to be able to increase uptake of those two services. And we've seen this in our analysis and in our work, that's where you combine service delivery, different services, children programs like immunization, family planning, you get more out of it. So looking at high impact initiatives that will increase uptake of those services is going to be really important, and that's what you sort of look at here, and how to better use the limited resources and put those interventions into the best foot forward, or put the best foot forward for those interventions. And then you develop the core strategies to address the system bottlenecks, that's the health system-wide bottlenecks, and understanding what strategies will best make that make those initiatives more effective. And then looking at multi-sector interventions, looking at different ways to coordinate between education, health, agriculture, food access, and things like that. So that would be that would include looking at things like looking at the access to, or looking at systems that are able to track people in a way that ensures that the critical and vital statistics, in a way that ensures that they are the right people are getting the right services as they go across different sectors. That's going to be really key. So the outputs you can expect from this process, once you've implemented all these activities, is identifying those, listing out those bottlenecks, ensuring that you have an extensive list, exhaustive list of all the key bottlenecks that impact SRHMNCAH+ nutrition outcomes. And then you outline the strategies and interventions that will address those bottlenecks and ensure effective delivery of services. And then ensure that there's a refined and amended health service and systems process in place to incorporate and pull together the way the interventions address the key bottlenecks. Again, the actors in this process will are some of the ones that we discussed earlier, and they include whoever the coordinator is for the process, who's leading this initiative, and it will also include your not only your Ministry of Health, but your legislative and executive branches of government, who are major decision makers around what resources get used for health. So it will be important to think about these decision makers and how best to engage them to ensure that they're able to muster the resources and the support necessary for the health sector, and particularly for the broad multi-sectoral approach to rolling out and achieving SRHMNCAH+ nutrition objectives. So you look at all these key pieces in addition to the legislative and the executive branch of your government. You'll be looking at other line ministries, including the Ministry of Finance, who is the holder of the wallet or the purse for the government, and decides on where those resources go. So you'll be looking at individuals at different decision makers within the Ministry of Health or within the Directorate of Public Budgets, and you'll be looking at if you have a separate Ministry of Budget and Planning, whether you have a separate and your Ministry of Internal Revenue, where all the government's resources are being generated and the funding streams come from,
So you'll be looking at all these different key players beyond the health sector, beyond the line ministries, and identifying them within their different roles in both supporting and providing resources and resources for ensuring that SRHMNCAH+ nutrition initiatives are successfully implemented and their objectives are met. So you'll be able to engage these different key decision makers through your legislative and executive public information days, or visit days with all the executive or the legislative offices. You'll be able to continue to work with your national technical working group for SRHMNCAH+ nutrition. You should be able to review all their work as they share it through these analysis review meetings or through public consultation, commentary events. So these are the key forums and the key players and the ways you can engage them. Some of the key questions that you can present to these decision makers in order to best assess how they're addressing these bottlenecks and creating the resources necessary to successfully implement SRHMNCAH+ nutrition includes, did they outline all the key bottlenecks that address? Are they addressing issues of access for low-income people? Are they addressing issues of access for hard-to-reach areas or peri-urban, rural areas? Are they addressing access issues for youth and other key demographics? Do the solutions the strategies that they develop actually address those access for those different groups? What are the revenue streams that are going to be used for financing SRHMNCAH+N initiatives? Where are they coming from? What is the government's plan for providing those resources in place? So those are some of the key questions that you need to ask. How and when the funds are going to be dispersed, who is responsible for monitoring the budget? Because generally, a lot of the budgets aren't managed by the Ministry of Health. They are managed by the Ministry of Finance or the Ministry of Treasury, and so on. And so it's important to understand who manages those resources and releases them. And it's going to be really important to ensure that you're engaging your legislative members, because at the end of the day, for a lot of our partners in their respective countries, the legislature is the one who determines the budget approves the budget, while the executive branch, whether it's the president, the prime minister, whatever executive branch government exists in your country, pulls together the budget. It's the legislature that approves that budget, or at least negotiates how much of that budget gets approved at the end of the day. So it's important to engage those key decision makers. I want to pause a little bit here to see if there are any burning questions. Again, I will remind folks that there will be a chance for questions and answer at the end of the presentation, and there will be a decent amount of time for very active interaction and discussion. So please feel free to, unless you have a burning question, you can hold your questions until the end, until we've completed the discussion of the investment case. I'm looking at the group chart and also looking at the I don't see any hands. Okay, so I will continue on. Fourth stage of the investment case process involves the cost and cost effectiveness. So essentially, what this means is, generating the cost estimates and cost effectiveness analysis of all those different interventions. How much is it going to cost? How much is it? What are the resources that need to go in there? How much is it going to cost to train healthcare providers? How much is it going to cost to increase medical supplies, and so on and so forth?
And so you can use, you'll be able to identify what the resource streams that fund the health sector. So as I mentioned in the previous stage, your internal revenue is responsible for managing the government's the government's total resource stream and directing those resource streams that are lined up to or mapped to health. And it's important to understand which resources you can expect to go to health initiatives from the government side. And then you'll be able to map them to say, well, if you expect this much coming in, you can expect this much going to specifically to SRHMNCAH plus nutrition initiatives, and when you can expect those resources to come through, because it's going to be important to understand the sequence of which government funds are released. That's going to be really important, because when the funding comes is when activities can be implemented. So it's important to understand that, so that activities are implemented in the time that they need to be in order to be able to achieve the expected outcome. So what you will expect to see once you've done your cost estimates and cost effectiveness is to identify those different interventions, so you have a full remit of what it will cost to be able to successfully implement your initiative. And generally people use tools that are use planning tools and process tools to help to generate these costs. One of those tools is called the One Health tool, which is developed by the World Health Organization, the World Bank, and implemented and developed and designed by Avenir Health. And they've been using this to support countries in their generating the cost of all their interventions for SRHMNCAH plus nutrition initiatives. Excuse me. So the key actors here remain essentially the same. They are your lead coordinator who sort of helps manages the shepherds the investment case process forward. Your ministries of health, your Ministry of Finance, who's going to be responsible for directing where funds come from, your budgets and planning, if there's a specific budget and planning ministry within that's separate from your Ministry of Finance, your GFF country coordinator, and your service implementers. And the forums you can engage with these people remain essentially the same: technical working group meetings, the public commentary events, and so on. So some of the possible advocacy and accountability questions you can ask around cost effectiveness and so on is basically saying, does this cost cover all the proposed interventions? Does it also include the multi-sectorals that's beyond health sector? Does it include the cost of ensuring that the Ministry of Education provides comprehensive sexual education, that the Ministry of Agriculture defines or designs ways to ensure that the right food supplies go into the nutrition program, and so on and so forth. Does the cost, do the tools that you use to generate your cost take into account those bottleneck challenges? And does it include how you will, the cost of actually addressing those bottlenecks? Do you have a good cost benefit analysis, cost effectiveness analysis? In other words, saying that this is the cost, are you showing cost and as well as effectiveness? So basically saying, are you actually looking at those high impact interventions and comparing it, the difference between, say, doing immunization and family planning separately, which doesn't have as much impact, and doing them together and having a greater impact. So looking at the cost of those two possible situations for rolling out your intervention. So that would be important, a key question to ask. Another key really important one is looking at your revenue streams and how they are mapped to funding your SRHMNCAH+N initiatives in your country or your subnational context. where, what are the government's resources that are coming in? As I mentioned before, what is the timing for those resources to be released in order to ensure that programs are implemented in the time that they are specified? So these are some of the key questions that need to be addressed. My apologies, I meant to state this earlier, that this slide is going to be made available to everyone. So don't feel like you have to write everything down. It's going to be made available, and this session is also being recorded, and it's going to be publicly available. So you can come back to it at any point in time to be able to review, to be able to look at the presentation as we move along. And the PAI team will also be available to provide responses to key questions that you might have after reviewing the slides and the presentation. So please don't feel rushed in trying to put everything down as we go along. All of this is going to be made publicly available to you all. The fifth process of the fifth stage of the investment case is prioritization of your strategies and maximizing your returns on investment. What does this mean? It means like identifying which of those strategies that you might have developed multiple strategies for rolling out your SRHMNCAH+ nutrition. But which of those strategies has the major impact? As I mentioned before, when we think about these high impact interventions, we're thinking about which interventions have the biggest impact in terms of expanding access, in terms of ensuring uptake of those services. The example I used before was, we find that when we implement family planning and we implement immunization and we implement antenatal care separately, that we find uptake is going well, but we get so much more uptake when we combine those three different program areas together in terms of their intervention, and we see a much more higher uptake of services when we combine them together. And one thing that we found is this, that one of the key reasons for this is that it saves time for women, children, adolescents when they come in to the clinic, where they have, a lot of people have very limited time and resources to be able to go in for these different services. And when they come in and they're able to get the immunization at the same time, they're able to get family planning services at the same time, they're able to get antenatal care at the same time, youth are able to address all their key needs. They're able to address their nutrition needs at the same time. All of this makes such a huge impact in terms of the uptake of these services that it increases the access and the utility of use of these services in such a way as to show greater impact in terms of the reducing maternal mortality, infant mortality, mortality and morbidity. So these provide really important key ways of so this process of prioritization helps you identify those key strategies that are the combination of those different interventions that will give you the greatest impact possible. And it also looks at the efficiency. It's a means of identifying what is the most efficient way for rolling out interventions in a way that ensures that you use you don't overuse your resources. You use your resources well to achieve the greatest of impact. And that is generally done by looking at different scenarios. A scenario is by saying that, okay, what if we do something one way, or what if we do it another way? It's like saying, if I'm going from Yaoundé to Lagos, I'm trying to find which is the best route for getting there. What's the quickest way to get there, and how much and how do I spend the least amount on fuel to get there? And so the scenarios say, okay, I can go through north and then come down south, or I can take a boat and just go straight from Douala to Lagos. So those are different ways to identify
scenarios, saying, okay, one scenario is going by boats, one scenario is flying, one scenario is driving, and the different ways in which you can get to your goal. So that's arriving in Lagos. So that's the way scenarios look at. They look at how can you reduce mortality, morbidity amongst women, children, and adolescents. How can you roll out interventions in the most efficient way possible by looking at those different scenarios? And those different scenarios will tell you the resources involved as well, so that you can do a cost effectiveness analysis or cost benefit analysis in terms of your assessment of which combination of interventions is most likely to achieve the objectives that you laid out. The key actors and their forums remain the same: Ministry of Health, Ministry of Treasury or Finance, budgeting and planning, your GFF country coordinator, and so on and so forth. I don't want to repeat that here, but the key questions you can ask here is, which set of interventions or combination of interventions and packages can be realistically implemented, because we can have all the desire to do everything, but realistically, what can be implemented in the time that you have? Which scenario optimizes all your available resources and inputs to achieve the biggest impact as possible? Which scenarios also addresses those inequities, those bottlenecks in terms of access and affordability of services. So it's going to be really important to identify, to pose these questions in order to better understand will this plan really do the most it can with the resources it has to achieve the impact, the desired impact. Now, step 6 that our colleague Augustine asked about before is the M&E process, which is the monitoring and evaluation process that is a key piece to the investment case. And what this essentially is how do you track your different implementation process in a way that ensures that they're implemented in the time that you expect them to implement. They're moving things along in terms of ensuring that interventions are reaching the right people at the right time, and reducing mortality and morbidity amongst women, children, and adolescents. And so those are key pieces of a monitoring and evaluation process. And at the end of the day, evaluate whether you're actually impacting the way you desire. So the M&E process means you have to develop an M&E framework, identify what are those key indicators that will help you monitor as you go along that things are going well or that things are not going as well, and you can make the changes that you need to make to ensure your outcomes are achieved. And it's going to be, you also need to identify what key investment needs to go into creating those M&E tools, those M&E tracking processes, like your vital statistics, civil registry and vital statistics system. And so the expected outcomes from this include your results framework, that's your M&E framework, as well as the timeline for which your M&E framework is going to be implemented. It's going to identify those key progress and output indicators. There are a series of indicators that exist, but realistically, a lot of indicators, there are different indicators that apply to different contexts and are available to people. So it's important to identify the indicators that are feasibly, can be feasibly tracked in your specific context. And at the end of the day, you want to have your M&E implementation and the costs of your M&E implementation plan, because the cost is separate. Since the M&E process is not about reducing maternal mortality, maternal, child, and adolescent mortality and morbidity, it's about how well you're moving things along. It's a separate cost estimate from your overall intervention costs. The key actors and their forums remain the same. I won't go into that. You can always review that at a later time. But some of the key questions that you can present, are the results reflected in the framework? Are the key important results reflected in the M&E framework? Is there a clear approach to improving the quality of financing data, particularly how resources are being gathered and reused? The M&E indicators actually identify those key things that you want to identify, so that you can either see how well things are going or address challenges as quickly as possible, so that you're not looking at an indicator but things are not going as planned. And so you want to be sure that you have those right indicators in place. You also want to ask how often will you be doing monitoring? Will you be doing it once a year? Would you be doing it twice a year, 4 times a year? How often do you want to be able to track your process, to share that information with key stakeholders, so that everybody is aware of all the changes that need to be made in the right time? The last but not least of all this process is the financing agreement. As it sort of specifies, it essentially is it's about looking at all the resources and the best scenario that will be the final part of your investment case. So it will basically say, this is the best way possible, most feasible way forward to rolling out our SRHMNCAH+ nutrition intervention, and it has the most impact in terms of reducing mortality and morbidity among women, children, and adolescents. And it has this overall resource requirement to do it that is feasible to generate the resources for. And so it will also, in addition to having this full plan within it, it will also provide ways to identify and secure both internal and external resources, looking at where all the resources are going to come in, to ensure that the resources to fund the implementation of your final plan strategy as it's going along, so that you're not moving along and you're stuck in a place without the necessary resources. And so you expect to see at the end of the day documentation of a high-level agreement between the government and all its partners, including whether it's subnational governments as well as external partners in terms of aid providers and bilateral aid and or multilateral aid. And then you have an internal agreement as well between all the line ministries, because there has to be agreement between Ministry of Finance, Ministry of Health, Ministry of Agriculture, Ministry of Education, all these key line ministries, on how they're going to coordinate together to ensure that this plan is effectively implemented. And so you'll have this detailed investment framework mapping out your investment case funding, all the resources that are coming in, how it's going to be spent, and how it's going to be rolled out from both the government and from all stakeholders, essentially. And so you'll have your key actors, who are your coordinator, your ministries of health, your Ministry of Finance, and so on and so forth, your GFF country coordinator, and your other implementers. And so you key questions here, that you want to present here is, are the government resources expected to be there as you were intended to be? Is the government meeting up with its own share of bringing funds to the table to ensure the implementation of these SRHMNCAH+ nutrition initiatives? And also what part of that funding is going to come from donors or from non-governmental sources, like the GFF, what part is going to come from other sources? And is there a general agreement? Is there an agreement in place between the different line ministries, between the government and the GFF, between the government and its partners? Because these are the agreements that need to be, essentially, they're like contracts, in other words, that says this is the role that this person is going to play in ensuring the resources are available. This is the role that this person is going to play to ensure that the interventions are implemented, and so on and so forth. And then you want to also understand what are the terms of the loan and grant agreements with the governments, because it's important to be part of that process to ensure
that it does not overburden the government. And so this being the final stage of the investment case, once you've finalized what your investment case, what the key pieces of your investment case are in terms of what the interventions are going to look like, the M&E portion of it, as well as where all the resources are going to come from, and an agreement amongst all the resource providers and resource dispersers. You want to be sure that all this has all come together before the implementation, so that there's a clear line that everything is in place before you start rolling out the interventions in place. So I want to put this pause here for our quick Q&A session, so that we are able to address some of the questions that you might have. The investment case stages, and also, maybe hear from your perspectives, and what are those entry and engagement points for the different investment case stages, and what your what are the burning questions or comments that you have. It would be good to hear, so that we can discuss that and maybe address your questions. And once we've addressed those questions, we can then go into a much more lively discussion amongst one another, because what we find is that, while the PAI, technical team can provide you these responses, the real sort of rich information comes from sharing experiences, because everybody has had, all the organizations have had different ways of engaging their country platform and their investment case in a way that helps us understand the breadth, the depth, the fullness of all the ways that we can ensure the successful implementation of the GFF partnership. So we want to encourage a very active discussion session. So let's use this few minutes here to address any burning questions. And once we've done that, we can have a breakout session to share amongst ourselves what are the learning experiences we've had about the investment case. So I'm going to pause and let folks ask questions. Please feel free to use the chat box. I think it's easier for us to be able to review your questions if you use the chat box. But if you're unable to, particularly for folks who have a challenging connection speed and may not be able to talk through the mic, please use the chat box to ask your questions. It's a lot quicker, and we can address your questions. So please, please share your burning questions. It's really helpful for us. It helps us jumpstart. Vincent, our colleague, has a comment. Vincent, over to you. Oh, Vincent, you're in the French channel, so you might need to jump into the full. You might need to switch to your other channel to be able to speak to everyone. Thank you. Oh, I'm not sure I can hear you. Let me see here. Oh, I can't hear you, unfortunately.
Hello.
Laminu has raised their hand. Please go ahead. Or is that Augustine?
Bonjour, ouais, je vais parler.
Laminu,
oui, c'est Laminu.
Ouais.
C'est Laminu du Niger, collectif Toon.
Ouais.
Merci pour la présentation qui est assez édifiante, qui a expliqué, qui nous a permis de comprendre encore une fois de plus tout le processus. Donc là, je vais intervenir justement par rapport à une des étapes, notamment l'analyse de la situation. Là, la difficulté majeure que nous rencontrons dans cette analyse de situation, c'est la collecte. Au niveau de la collecte de données, et notamment l'accès aux données par les OSE. Je ne sais pas si c'est spécifique au Niger, mais en tout cas au Niger, et après discussion aussi avec d'autres pays, et à travers des forums, c'est un problème qui se pose avec acuité, c'est-à-dire la collecte des données et l'accès surtout aux informations du système sanitaire, l'accès aux données. Et ça, c'est vraiment inhérent c'est commun aux OSE ici au Niger. Le plus souvent, les OSE sont perçus comme étrangers au système et donc limités. Et donc, de moins en moins ayant accès à ces données-là. Donc, nous, à notre niveau, au niveau du collectif, tout ce qu'on a fait déjà, je pense que c'est une sorte de mitigation. C'est qu'on a réussi à intégrer quand même le système. On a intégré le système à travers la multisectorialité. La multisectorialité, c'est-à-dire c'est le ministère de la Santé, c'est les réunions au niveau du ministère de l'Agriculture, le ministère de l'Élevage, au niveau du ministère de l'Hydraulique, à travers un cadre concerté. Donc, on a réussi à intégrer ce système-là. Et aussi, notre présence dans les différents comités techniques, c'est-à-dire des groupes techniques de travail. On a un espace qui se réunit vraiment tous les mois, chaque fin de mois. Et on a réussi à intégrer ce groupe technique de travail. Alors maintenant, je ne sais pas, c'est des conseils. Est-ce qu'il y a autre chose que les OSC peuvent faire? Ça, c'est vraiment un conseil que je demande pour améliorer cet état de fait, pour qu'on ait, peut-être pas que le Niger, mais pour que la société civile ait vraiment accès aux différentes data, aux différentes données, pour que ça nous facilite cette analyse de situation, pour atteindre les objectifs à travers les différentes ce processus-là. Alors, l'autre aspect et qui est aussi en rapport avec cette question d'analyse de données, c'est l'analyse budgétaire. Nous, au Niger, on a réussi à faire l'analyse par 2 fois, analyse budgétaire justement pour voir, ça c'est maintenant en matière de la nutrition, pour voir la contribution de l'État, mais aussi la contribution des autres bailleurs en termes financiers, pour voir alors à la fin qu'est-ce que l'État peut faire pour peut-être prendre en charge et renverser la tendance, parce que pendant plusieurs années au Niger, on sait que c'est les bailleurs de fonds qui financent beaucoup plus cette problématique de la malnutrition au Niger aux dépens de l'État. Mais depuis les travaux qu'on a eu à faire, les analyses budgétaires qu'on a eu à mener, les différentes discussions qu'on a eu à faire avec l'État, mais vous êtes sans savoir qu'au Niger, il y a une feuille de route aujourd'hui qui est mise en place et pour vraiment renverser cette tendance-là. De plus en plus, l'État s'intéresse beaucoup plus avec des enveloppes de plus en plus grandes pour prendre en charge cette question de la nutrition. Donc, je pense que c'est des analyses comme ça qu'il faut faire, mais ce n'est pas sans grosse difficulté. Alors là, je pose cette question ici pour que on puisse, je ne sais pas, peut-être vous, PAI, peut-être les autres pays, partager leur expérience avec nous pour qu'on améliore notre approche justement à la matière. Voilà, d'autres aussi difficultés qu'on a, et ça c'est aussi, je ne sais pas, c'est lié à, pas seulement au Niger, parce que dans ce processus-là, il y a beaucoup
de... Merci beaucoup pour votre question, Lamine. Thank you so much for your question. Lamine asked a very important question, and I will try to address that, but I want to take in a few more questions so that I can...
Merci.
Yeah, merci beaucoup. And I'll take in a few more questions so that we can answer all those questions together. Is next person who might have a question, please?
Good.
Colleagues from
Greetings.
Hanet? Yes, please, go ahead.
Yes, I had just sent a question in the chat that
Yes.
Kenya is currently classified as a low middle income country. So we want to know if that affects our investment status, given one of the objectives of GFF was to support financing transitions. So if it does, how does that affect our reinvestment status? Because we have just finished the very first case, that was 2016. Then we had a no-cost extension for 2 years. So we are just in the phase of trying to redevelop, actually the very initial stages. So does that affect, and how?
Thank you very much for your question. That's a very good question in terms of how a country transitions from one income level to the other. I will hold that question for now and wait for a third question if there's any burning questions, so that I can address all those questions together, and then we can move quickly into our discussion section, because I think that's going to be the richest part of this conversation. Somebody from Nigeria says that they'd like to know if there's a limit to the number of investment cases that can be made by a country. That's another good question. Thank you. Anyone else with a burning question? Okay, so that we can move along really quickly, I'll quickly address the question. So the question that Laminu asked is along the lines of, how do you ensure access for CSOs, the data that they need to be able to track effectively there's a question from our colleagues from Vietnam in the chat. My apologies if I'm missing it. Has any workshop sharing about GFF process organized for governmental agency in the eligible countries? Okay, so let me try to answer those questions as quickly and as effectively as possible. So the first question from our colleague from Niger was around accessing data, particularly government data, around the implementation and tracking of their SRHMNCAH initiative, the investment case. I think that's a really important part, and I think this goes back to our the first stage about defining who gets to be part of the stakeholder process, who gets to be invited into the stakeholder, because that outlines from the get-go which key partner in the framing of the investment case has a decision-making role to play in terms of the investment case overall. I think that's a key piece to ask. But that's not just the only part. That's an important place to start. But the other part is also engaging with your country GFF coordinator and posing these questions to them and asking them what is the part that CSOs are part of the GFF's objectives of inclusion of objectives for the GFF. How can they access the data that they need? And a third way to engage this process is to work around the advocacy solutions that our colleague Laminu suggested, which is working with coalitions to engage the government and hold them accountable and advocate to them and show that the role that CSOs play is important in terms of sharing information. So those are three ways to be able to address that issue. We're running a bit out of time now, so I'm going to try and address the other questions. The question from our colleagues in Kenya is around the classification or the transition of Kenya from a low income to a low middle income country. That's a very important question, and I think that has a few bearings. That's only one factor in the decision of the type of amount or ratio of investments that the GFF puts into the country. So I think that question would be best answered by the GFF country coordinator or your country counterpart, sorry, your government's counterpart, because they get to understand how that the transition of the economic status of your country factors into the decision. And so they might have that question readily available now, or there's a process that's currently being discussed around whether or not the country investment in the country income status affects the reinvestment or investment case process. And that I think is a conversation that's also happening, that's definitely happening at the GFF Secretariat level. So just to address that, the another question that we try to address is there's a workshop around sharing of GFF process organized for government agencies in eligible countries. That's a good question. This process that the GFF CSO host and the civil society convening group, we are try to work in coordination with the GFF Secretariat to understand what are the other government processes that are happening. But in all honesty, there's a different track within the GFF that deals with that process, and that often involves the GFF country coordinator. So again, I feel like I could give you a lot of possible answers, but I think this is another question that will be best answered by a GFF country coordinator, because they have a lot of information available to them. And if they're unable to answer that, please let us know, and we will forward that information and share it with the GFF Secretariat for their input, and we'll share it with you at the earliest opportunity.
Hello?
Yeah, Augustine, can you please hold on while I finish this question, please? Thank you. So the question from Ruth is, if there's a limit to the number of investment cases that can be made by a country, there can only be one investment case at a time. In terms of sequential limits, in terms of how many investment cases can be made for a country, I'm not aware yet if there is a limit to it. I think part of that limit is dependent on how well the country has, one, achieves their goal of reducing mortality and morbidity amongst women, children, and adolescents, and what their income status is, or what their general investment, domestic investments are for the GFF, for the SRHMNCAH initiative. So those are key pieces that affect how much you can, whether your country proceeds to the next investment case. Let me see. I see there's another question here. I think, Augustine, can you please add your question to the chat box? I think that will be really helpful for us to be able to address, because I think that's the next way, because we really are strapped for time here, so that we can have a lively discussion as we move along. There is another question here from another colleague from Niger, which is what role can civil society play in terms of citizen oversight and accountability? That's a great question, and I think an important question is that can also be set out in terms of the investment case approach and its, as well as its implementation. I think part of the goal of this GFF overall in ensuring CSO participation is to increase citizen oversight and accountability, to ensure that civil society are involved in the process. So, part of this, because of this mission, you can approach your GFF coordinator and say, look, we need to fulfill our role as oversight and accountability partners to this. And it's not an antagonistic role, it is a supportive role. And to do that,
it requires being able to access and be part of the decision, the stakeholder platform. And so, one of the key things to put to the GFF coordinator and the governments as well is saying, CSOs have a role in this, and that's been established by the GFS as well as respective countries. So they need to step up and meet that objective, and that will be important to be able to put forward. There's another question here about the relationship between the country's partnership framework with the World Bank and the GFF financing the country. So yes, that's a great question. So each country has an overall World Bank partnership framework in which there's an agreement about all the things that will all the activities and all the implementation, all the plans and initiatives that are supported with World Bank funds and with World Bank partnership and support. So with your governments, and there's a signed agreement, and they work together on this process. And the GFF agreement is part of that, because GFF is also part of the World Bank. So there's an overall framework that was with the World Bank, of which includes the GFF process as well, and that's to ensure alignment. One of the, as we mentioned earlier, one of the key objectives of this partnership between the GFF and your respective countries is not to duplicate effort, not to create different streams of partnerships and work, but to ensure that they're all built together, that they all align with the country's overall objectives and strategy and plans and so on and so forth. And so this agreement in place also ensures that that agreement is in line. So it ensures that there's no there is as I say, positive overlap in terms of how these agreements get put in place. Please keep sending your questions in through the chat. We would like to move this conversation over to I'd like to move this question into this session into the group discussion stage. I will, as partners are moving into, as everyone moves into the group discussion phase, I will be answering your questions in the comment chat box so that you can actually see your responses. But I want to provide a little bit of a structure for the breakout sessions, because that will help ensure that we have a rich conversation in place. And I will set up the breakout rooms. There'll be two. We currently have approximately 30 people, and so we'll have 3 breakout rooms. Actually, wait, let's see. Quite a few people from PAI here. So we will have 3. We'll have 3 breakout rooms, and we will try and follow this discussion guide here, this small group discussion guideline. And the questions for you to discuss within these groups is, is your country developing or already implementing an investment case for your GFF application? That's for those who are having an initial investment case, and a reinvestment case, well, the second stage. What stage are they currently in? What is the structure and the process for the CSO engagement? And what key questions would you like to answer? I'm going to assign one of our team members to help provide. Vincent will join one of the groups, and then either our colleague Eric or Tessa will join the other. And understandably, not everybody is an interpreter, but we will try to manage the group session. So I think it might be better to have two breakout rooms. So I will put that in place right now, and then we can spend the next 20 minutes in the breakout sessions. So let me quickly set that up right now. We'll have about 13, 14 people per room. Perfect. I think it has the Bonson and in there. So I'll it seems like there was such lively conversation going on, and I would have loved to keep this going, but we really are at time, and we think that I think it's important to be able to continue this conversation. Will be available to you via email or phone call to answer any additional questions that you might have. And we will also look forward to ways to continue to engage partners to ensure that there's a discussion forum around this, around the investment case and other aspects of your work and engagement with the GFF. I know we will have we're well almost at 3 minutes now to the end of the session. But I wanted to share a couple of things with everyone so that you can all sort of get an idea of all the other resources that are available to you. As I mentioned earlier, we are recording this session so that you'll be able to access it at a later time. So we'll make it publicly available. We will also be available to you by email so that you can answer any questions. If you once you've had a chance to review the presentation. Oh, and the slides will be publicly available too, so that you can review the slides on your at your own time and with your own pace. And lastly, we will be sure to where your PAI contacts are always available to you. So if there are any key questions and burning questions that need addressing, please feel free to email us, and we will get back to you as soon as possible. With that said, I want to thank you all for your time. And one very important thing that I didn't get a chance to say is that there is a brief, a guide to this entire conversation that provides very in-depth understanding on the investment case, as well as all other aspects of CSO engagement with the GFF. This was developed over the years by the team at PAI, and is available to you to view. Let me share that with you now, so that you can all see what I'm talking about. So the civil society guide is as I mentioned before, is this that's available here. It was updated earlier this year, and it provides a very thorough view of all the work that your engagement with the GFF. And it's not just covering the investment case; it includes all of the aspects of the investment of the GFF partnership and all the key questions and processes that you want to ask. And it provides some very important case studies and also examples of how you bring together civil society to engage on these key questions. So please avail yourselves of this CSO guide. Let me post the link to the guide in the chat box, and then so that you can access as well.
and we will share this link as well as the presentation and the recording of the video of this session with you once we've compiled everything and you can access it. With that said, I want to thank everyone for their participation. There's never enough time to get into the meat and the details of all the details of this conversation. And we would like to keep the conversation going. In addition to that, we would also like to build on this conversation. And one of the key things that we noticed is that the GFF process is pretty deep, and there are many steps to it beyond just the investment case. So we want to talk about other areas. We are happy to. We would like to set up a second session looking at the different implementation phase of the investment case, the actual implementation of the SRHMNCAH strategy, and what that looks like and what roles partners can play in that. We can also talk about domestic resource mobilization and what that means in terms of how the government mobilizes domestic resources, identifies key sources of funding and revenue that will go towards not just the health interventions specifically, but the multi-sectoral interventions that help to ensure that SRHMNCAH+ nutrition initiatives are successful in both implementation and outcomes. So we want to be able to discuss all these other key pieces with you, and we will be planning and scheduling a second session to discuss this in more detail along the lines. With that said, I want to thank you all for your really insightful questions and comments, because they helped move this conversation along. We at the PAI team, that are your respective contacts, we remain available to you to answer and address any key questions, and we'll be following up, as I said before, with all the information that's been shared in this session. I want to thank you all again for taking time from your busy schedules to attend this workshop session, and we will stay in key contact with you all, and we look forward to continued discussion and partnership. Before we end, though, we generally like to sort of see everybody's faces so that we can also sort of acknowledge everyone, and you can get an idea of the breadth and depth of all the people that are involved in this process. So I want to take a time to just share video. You don't need to say anything, just share your video so that we can, this is me, and we see colleagues here. Please turn on your video if you can, and we will take the pictures once everybody's video is on. I'll give a quick minute to do that. And see if there's anybody else that's available. Let's see, more people are turning on their videos. Please keep your video on, and we will we'll take a picture once everybody's video is on, and then be sure that we are capturing everybody's faces before we sign off. Let me see here. Is more people joining? More people are joining. Oh, I see Sharon from Hennet. I see Nanja Bolo from CWJH. Idrissa from Niger, from Tuan. Oh, excellent, excellent, excellent. Okay, so let me take another quick screenshot. Anybody else? Let me see. Please keep your videos on. Thank you so much. Let's see. Hold on. Excellent. Thank you all so much for being part of this session. You know, we couldn't have done it without you. We're really grateful to you all for your for participating, for your questions, for everything that you've sort of like shared with us. It's so important and makes this session even much more fruitful. We're really grateful to you. We remain available to you, you know, to answer any key questions and to be able to continue our work and partnership together. Thank you so much for your time. I hope you have the good rest of your day, evening and nighttime. I know in Vietnam it's already nighttime time, so thank you so from SCDI for joining. For those in the evening and afternoon times from Burkina to Zimbabwe to Kenya, thank you so much. Thank you so much. And Sierra Leone, yes, our furthest west,
Ghana.
And Ghana, from our West African peoples, Nigeria,
yes,
from Kenya, from yeah, we've got tons of people from Zimbabwe. Thank you so much all for joining this. It's deeply moving and thankful, grateful to have you all. I'll let you go. Thank you so much for your participation, and we'll follow up. Thank you. Thank you.
Thank you, Adesanya. Thank you also. That was very interesting presentation.
Thank you.
Appreciate
you.
it. Appreciate it. Yeah.
Thank you.
Pleasure. Thank you.
Thank you.
Thank you.
Right.